This is how we persuade the immune system to fight cancer. We exploit the natural properties of dendritic cells to make a kind of vaccine-like immunotherapy against early breast cancer. To accomplish this, we remove the white cells from the blood of a patient with DCIS and through a special procedure, isolate the dendritic cells. We culture the cells overnight in a nutrient medium that contains conditions favorable for dendritic cell function. Then we add two things to the dendritic cells. First, we add some of the very chemical signals dendritic cells use to identify foreign microbial invaders. Then we add a synthetic version of the HER2 breast cancer protein. HER2 is a naturally occurring protein in the body, which is greatly overproduced by some breast cancers, marking them as abnormal. These conditions fool the dendritic cell into behaving as though it has discovered a dangerous microbial infection. These cells become highly activated and decorate their surface with pieces of the synthetic HER2 protein, just as it would have done with proteins from a microbial invader. After this has been accomplished, the dendritic cells are collected and injected back into the body of the cancer patient. The dendritic cells seek out T cells just as they would during a microbial infection, but this time they are showing the T cells a protein that marks a breast cancer cell rather than a bacterium or a virus. Nonetheless, the T cells behave identically, multiplying into an army of cells that will go on a search and destroy mission against anything bearing the HER2 protein, namely the breast cancer. So anywhere the breast cancer cells reside, the T cells will seek them out and attempt to destroy them. After years of work, research, development, and patient trials, this approach to fighting cancer is really paying off. In our next video, we'll take a look at the evidence that yes, our immune system can be successfully enlisted in the fight against cancer.